Welcome to another episode of Management Unfiltered. I am Kirk Teachout.
And I'm Zach Shelley. And previous episode, guys, we talked about how to attract hygienists, which was part one. And we're going to come to part two, which is how to retain hygienists in your practice. Like we always say, this is Management Unfiltered. We keep it clean, but we're definitely unfiltered. We will not shy away from the hard subjects and tell you you're stupid if you're being stupid in a dental practice, doctors, team members alike. And let's dive into this. So, Kirk, what are we talking about? Retaining hygienists? Like, what does that mean?
Yeah, so like in the last episode, we talked about attracting, right? And trying to set the standard to set expectations properly. So that way when we have somebody that actually comes into the practice, then they see the culture, they see the team, they see all these things that they're now going to be doing. But where I believe a lot of people get things wrong to really breed that loyalty is they don't work on systems for one, right? So when you now place somebody into a broken system, things get chaotic, very chaotic, and you don't want to burn people out. I will have to say that if you have streamlined systems, not only does your burnout go down, your team turnover goes down, your patient turnover goes down, right? This isn't about systems, but still, yeah, like you have to have good systems and to be able to place people in. Say you have this new hygienist, she's great, she has a great personality, or a hygienist, right? The 2% that are out there. Shout out to Elijah Desmond, right? But still, if we can get people into a good system to where the patients are great, this team is flowing well, and we can hand things off properly, then they'll feel a lot more comfortable coming in and not just have to be thrown into the fire. That's something nobody likes doing. Sometimes you have to, but for the most part, if you can minimize that, that's the ideal situation.
Yeah, there's parts of it that you need to throw them to the fire. There's parts, but the problem is we put that as a broad stroke of let's just throw them completely in the mix and just walk away. So with that statement of throwing into the fire, like yeah, throw them in the fire in parts of it, but like you still need to be there as a support system. And I think part of those systems is your hygiene, your current hygiene team understanding the onboarding process of a hygienist and having them support, because as an OM, like we do understand hygiene, and I will say I know it very well. And there's been times where I'm like, why am I teaching you this? To a hygienist, we get to those points. But there's other aspects of like there's only so much I can do. I'm not actually a licensed provider, but you're one that can sit alongside them in a system and these and say, hey, this is what I would do in this situation. So empowering your hygiene team to come alongside you in the retention of your hygiene team. And I think when you build that cohesion and culture in the practice, that's where you see a big change, right?
For sure. And you can really, I mean, it's as simple as writing it out, right? It's like, hey, they are providers, right? They have gone to school, they're licensed, they should know what they're doing. The nuance is, okay, but what do you want to do in this practice specifically? Like the practice owner wants you to do it this way, as long as it's legal and ethical, like this is what we want to do. Here's the system of how we do that. As far as what I call the circle of success, which we'll have a completely other episode on that. But how do we want these handoffs? Right? What is the checklist of the things that we do during the hygiene appointment? What are the things like where do we fall on fluoride? Right? Little things that can really set you up for success as a hygienist. But you have to have those streamlined and written out. I would say that, most people, even us, like our practice, we didn't have things written out. But the more that we've gotten along, we've been able to write these systems out. It's like, hey, here's what I want you to do day one. Here's what I want you to do the first week, focus on the second week, and so on and so forth. So that way, when you're coming up to, day 30, and sure, they've gone through some of the fire, they've met some of the patients, they're doing an amazing job because they should have that floor, that standard, right, of already being a great hygienist, knowing what they do as a hygienist. But now things are going well, right? They're probing on when they should. They're checking for x-rays. They're doing all the things that they should be doing, being prepared for the morning huddle. But now what is that next step to getting them to where they feel comfortable, they feel empowered, and they feel a part of the team after those 30 to 90 days.
And I think empowered's the biggest thing. Um, if you're just listening, you need to watch the episodes because Kirk's doing some funny stuff with his face. Not his muscles yet. We haven't seen his muscles because that was an attracting hygienist. Um, so the big part there is empowering your hygienists and getting them to feel that they can actually practice as a licensed provider as they are. Because a hygienist is not just a OJT position; like they are a licensed provider in the state that you work in, and there's certain services that most states allow them to anesthetize. So like let them do what they are one licensed to do, but also empower them to max out what they're able to do as a provider. In order to one that gives a sense of appreciation and value and wanting to stay because the doctor trusts the hygienist to be able to utilize their skills to the fullest ability. And then also the other portion of that is like that just builds that whole sense of culture, because when you don't have the ability to do what you can do, it's so frustrating, and nobody's going to want to stay at a practice that they can't utilize their skills, or if they feel like they're being held back or they're not encouraged to hey, prep the doc and say, hey, this is going to be an SRP patient, or this patient's going to need a crown. I already told them like, hey, that might be what they do. I got to go check with the doctor first. Like, you're not diagnosing, but you're teeing the patient up to get them to understand what's going on. Like, how to read radiographs. So they're like, hey, what is this? I'm going to have the doctor take a look at it, but he may be recommending some work for you. And allowing these hygienists, because we did that in our practice, and our hygiene team crushed it. I mean, your hygiene team should be producing, a third or more of your production every single month. And if it's not, like, look at your numbers. I've seen some offices it's only producing like 15%. Your practice is dying. Your hygiene program is the lifeline of your practice. So get these hygienists working for you. If you're listening, like, stop being difficult, stop being a turd, and like let your hygienists work how they need to work.
If you can think of it this way, this is how I try to think of it. Like, right, everybody's licensed, or well, not everybody. Everybody in the back is licensed or should be licensed, right? So you guys are a team, right? You have a patient sitting in the chair. You have the hygienist doing their part, the doctor doing their part, sometimes the assistant doing their part if it's assisted hygiene, whatever. And we should not be butting heads, right? So when you sure, like if there are some times where you butt heads, and that's fine. Like if it's a 10 out of 10 of importance to you, you should definitely butt heads on that. But try to come at it with an open mindset, like we've already talked about in the last episode, right? Um, so that way we can have an abundance mindset of like, okay, maybe I'm wrong, okay, but I'm gonna at least verbalize this in a respectful way to the doctor, to whoever, to even the patient, right? To try to make sure that I am doing what's right, what's legal and ethical, and what's right by the patient to get them 100% healthy. That's the goal. And now you have a team of 2 to 3 people now that are coming together as licensed professionals. So like, hey, you are the treatment team. Show some ownership in that. Come together like, okay, hey, these are your expertise. These are your expertise. What do you think? And have trainings on that too. I know my wife will sit down with the hygienist based off the treatment style that she has, right? And they'll just sit there and look at x-rays. They'll throw an x-ray up and be like, okay, cool. You have your notebooks. What do you see? And they will go through and they will write down what they see based off of their professional opinion. And then my wife will say, okay, here's what I saw as the doctor, and here's what I would diagnose. Is that what you have? Right? So that way you can align. I think most of the time when hygienists get very frustrated is because there's not alignment.
Yeah, it's a lack of understanding, right, Kirk? Like, a lot of times I'm big on, why do we do things, right? And if your hygienist doesn't understand why you're cutting a crown on this patient, and it's not a challenge statement, but understanding why, and it's almost like a why and when, and this would be a good one for clinical unfiltered for Dr. Sasha, like why and when you do crowns, why and when you watch an incipient, and it's these situations. Like, you can also say, hey, hygienist, I need you to help support me. I want to stop treatment planning watches on these 4 surface amalgams that have cracks in the teeth, and I want to make sure I'm crowning every single one of those. So you see them, say, "Doc, I've got a crown for this tooth. What is it? 4 surface amalgam, visible cracks." Perfect. I've already teed the patient up. You can start teeing your hygienist. They're not diagnosing, but they're telling the doctor, "Hey, I've got a patient in the chair of what you told me you want me to be looking out for." And I told the patient, the doc's most likely going to want to replace that with a crown. We're to that point, so we can make sure that this tooth keeps its longevity. And the amount of production that you can increase just on that, or another simple procedure of, hey, they have amalgams, let's get them out and replace them with composites. Like, you can tee your hygienist up with whatever you want, and you will instantly see overnight an increase in production in your practice, and an increase in cohesion and good culture in the practice. Because the hygienist's like, dang, that was the easiest treatment plan I already had. Because the patient's like, I'm good to go. Like, it streamlines that whole treatment plan process and understanding why they need treatment. Because a lot of times the patients will listen to their hygienist over the doctor. And I'll tell you, time and time and time again, the doctor said, "Hey, I recommend a crowns on that." The doctor leaves the room. What would you do? Would you do that? They ask all the time. And it's like they trust the hygienist more than they trust the doctor. So utilize your hygienist to get treatment plan acceptance.
I mean, we'll get into that like deep dive on like what I believe a hygienist should do or assistant or whatever, but the team should really be 80% of that heavy lifting and trust, right? So that way when the doctor comes in, it's just you're lobbing it up for them, and then they knock it out of the park to do what they're licensed to do, which is diagnose, right? So yes, I agree. This is a crown. You've got the cracks. Here it is. Did Lee explain that well? Yes. Oh, awesome. Lee's awesome, right? Right? She always does a great job, right? You always talk back and forth and talk, yeah, that positive reinforcement to where the doctor just says, "Okay, I look forward to seeing you soon for that crown, Miss Jane," and walks out, right? So there's this sense of urgency, there's positive reinforcement, and you talk positively back and forth to each other. I think that's another thing that will really retain your team in general, right? Positive reinforcement, talking up the next person. When they do something well, just talk them up. Not only does it help with your, mindset, but it also helps with their everybody likes a compliment. Some people fish for compliments, but everybody likes a compliment, right? So if you can now talk people up, I can't tell you how many times we've had patients just say, "Man, you guys are so nice to each other," right? Because it's just verbiage. It's what we say. And naturally, even if we don't believe it, we will eventually believe it if we say it over and over again, right? If you tell a child that they're stupid over and over and over again, they will believe that they're stupid, right? So now if you flip it on its head and tell people how great they are all the time and actually mean it, then naturally people will rise to that standard. Another thing that I do believe, we talked about, misalignment, right? So if the doctors and the hygienists have misalignment as far as what the protocols are, like clarity is kindness. We keep saying that, right? If you are clear on what these protocols are, doctor, that you are looking for with your perio protocols, with different things, right? It's like give it to your hygienist, let them know so that way they know the standard of care in your office. This is what we're going to do. So that way they can be informing the patients on what this is and know exactly going in like, "Hey, I see this, this is what happens." An if then statement, right? If this is this, then this happens. Then I went to this conference one time, and they had the head of statistics for the Department of Labor, and he was talking about how we're going to have this massive shortage, not only in hygiene but just like in general, right? Because once the baby boomers are gone, like that's a massive generation just gone now from the workforce, and we're going to have a really low point of entry for a lot of positions. So now he was just saying, look, you've got to be able to have an education system essentially. If you're not growing, you're dying. That phrase of like, okay, if they're not learning, they're leaving. So something we always try to do, and now's the perfect time towards the end of the year, is like ask for next year. What are you focused on? What do you want to learn next year? Right? Get them excited about learning something new, learning a new procedure. So like my wife just did a laser course, and yesterday was the first time we implemented it, and she did it on 3 different patients for different things. Okay? We only did it we only got one for gum contouring for large case like cosmetic cases, but we did it for TMJ stuff, sensitivity, all sorts of stuff. The hygienists started to see it and they were like, "Ooh, we want to learn this. We're going to pay for it." Like, "Hey, yes, that's the goal. We're going to educate you or get you to an education piece to where you can learn about lasers, learn how it can help your patients, and allow you to learn a new skill to bring back to the practice." And but here's the kicker. Anytime somebody goes out, we pay for something and they go out, they always have to come back and present to the team how we're going to implement what they just learned, right? But if you have these systems in place where you're talking each other up, you're going back and forth on education and sending them out to learn new procedures, new things. What is the new standard of perio protocols? What is the new standard of these things? Invest in your hygienists, right? Just like you invest in your CE, invest in their education too. And they will come back and be super loyal. You'll be able to retain these people so much better.
Because that was good. That was a good way to kind of close that section of it out. Now, this is still on hygiene retention, but I think one of the biggest things that frustrate hygienists, and this can be the whole office, but it's not just the doctors; it's the front team. The front team mucking up their schedule, not looking at appointments correctly, understanding how SRPs work and perio diagnosis works, getting patients in for too short of appointments if they haven't been in for so long. And I think this is another way for hygiene retention is you lose a lot of hygienists because of how the front office runs. And a lot of that rolls into how the office manager handles that team and how they train them in understanding. And I think this is one of the biggest deficits in dentistry is we sparse off and we put these silos up of here's front office, here's assistants, here's hygienists, here's doctors. But we don't ever mush those together and smash those silos and mix all that grain together and say, hey, everybody's going to learn everything. And I'm a big firm believer. Like anytime I was training a front office, I was like, hey, you need to understand why we do this. I'm like, I put together an entire book, a clinical book on perio, on SRPs, um, hygiene appointments, why we do them, the timeframes, what we're looking for, questions we ask, trigger words to know what's going to determine one way or another, what a crown is, what a buildup is, why you need a buildup, what doctors are looking for, what's an incipient, what's caries. Because a lot of people are like, I hear caries, caries, caries. Is like, it's cavity, it's decay. Like learning these fancy dental words, but then they can start understanding what a composite filling is, what an amalgam filling is, why we do this, why we do that, what fluoride treatment is, why are people against fluoride treatment, and getting them to understand all these things. Because if you want your back office and your hygienist to be able to be doing what they need to do, they also need somebody to work with them that understands, hey, I can get this patient done, but I need you to do this, this, and this. If the front team automatically sees this and says, hey, I've already taken care of that for you, they're like, dang, I'm able to produce. And if you do have a production based bonus, having that front team understanding how to do that will empower them to do even better. Because if they have an incentive that they can never reach, why even have it? And so I think that's a big, big miss. And I think we lose a lot of people, really, really good hygienists at good offices because we miss that mark.
This is the reason why the bonus system that I set up every time is based off the team working together, not based off of the individual working, right? Because just like you were saying, it's like if the doctor and the hygienist, they could have had it closed, the treatment closed in the back. If it gets to the front and it doesn't get scheduled, it's not closed, right? Which, once again, you got to set that up for success to where the only objection in the front is just time and money, right? Just trying to figure out the time and the money. But another big problem with the schedule, right, with the hygienist too, is like, oh, my whole afternoon just fell apart. Well, now what do I do? Now, my hygienist will jump in and actually start calling people, right? Which is good, but I don't want somebody who is 40, 50, 60, $70 an hour calling patients. That's once again, we work at the height of our license. Okay. Does it mean we shouldn't? No. Okay. We're all going to jump into the trenches and do whatever needs to be done. However, they should not be doing that. Okay. Because if we have things rolling correctly, the front office should have the ability to be able to do that if an afternoon falls apart, and have the systems to where you can. So, making sure that, something that I do to keep our hygienist happy and their schedules full at all times. Very rarely do we have an opening where we can't get filled, even if it's like 30 minutes before, because we call patients 24 hours before, after we've sent all the text messages, all like in the last 2 weeks, we call them 24 hours before, not all of them, just the unconfirmed ones. Because everybody gets a text the day before just to remind them again. It's like, hey, thank you so much for your reservation tomorrow. We look forward to seeing you soon. But we call everybody who's unconfirmed and just say, hey, Miss Jane, unfortunately, we haven't been able to get a hold of you. And if we don't hear from you by noon today, then we're going to have to reschedule this appointment. We hope to hear from you soon. Every single unconfirmed gets those calls. Now, it's normally, maybe 2 to 5 patients. It's not a ton that you're calling, but you double book those patients if they don't call by noon. And if for some reason the 10% chance that Miss Jane does come in, then it's like, hey, Miss Jane, we've been trying to get a hold of you, so we're going to need to reschedule this. And next time Miss Jane will make sure that she confirms that appointment. And then your whole afternoon doesn't fall apart, right? So not only does chaos make your hygienist frustrated, but also a huge empty schedule because they feel like they're not doing anything. And then the doctor is wondering, like, well, they're just sitting over there on their phone, like not doing anything. It was like, well, that's not always their fault, right? So if you can get these systems right from front to back, back to the front, that really keep the schedule full. To me, a hygienist, a good rule of thumb is $1,500 a day in production, right? So, um, that's roughly 3.3333333333 times what they're getting paid. Okay. um, so, like you were saying, they should be about a third of the production in the practice. And if they're not, then there are things that you can do to educate on, not be salesy, but like, hey, I mean, honestly, if you just do the bare minimum, you should be doing 30%.
Yeah, and that's just looking at the health of your practice. Docs, if you're listening, look at your hygiene. If it's less than 33% or 1/3 of your practice, then look at your unscheduled treatment. It should align. And then you can start breaking down, okay, what's the first thing I'm gonna look at? Well, let's look at that. Let's look at the hygiene team and what they're able to do, what their reappointment percentage is. Start digging into some of those percentages and seeing how you can build and grow your practice. And then also incentivize your team on that. Like we talked, there's so many ways to do bonus systems. We'll do an next episode. There, it'll probably be multiple episodes with controversial topics. And I know Kirk and I have different ideology on that, which is fine because there's no one way to do it. The biggest thing is making sure it's attainable. But you incentivize your team, and a lot of doctors are like, we'll get into it more, but they're paid a salary and they should be able to do their job. Well, yeah, but do you want them to go above and beyond? Do you want them to add $100,000 in production a month? Like, because you can make that happen. Um, and it just depends on how hard you want to push and how hard you want to empower them. And that's the biggest thing. If there's one word we take away from this episode, it's empowerment. Like, empower your team to do what they need to do and encourage them to continue to do more and more. Encourage them to take those courses to learn just like you want to learn.
Well, and I want to read the definition, the Oxford definition for empowerment: authority or power given to someone to do something, right? The process of becoming stronger and more confident, especially in controlling one's life and claiming one's rights, right? So if you give them some autonomy to make decisions for themselves, that's within your parameters and protocols. That's where you empower your team, right? And we'll go even further into that, right, on another episode. But empowerment is important, to give them, the ability to make those decisions on their own, not just be a dictator and say, you do exactly what I say, right? Uh, but Zach, man, this has been another great episode. I know everybody's now going to be able to retain 100% of their hygienists. Um,
But I would say just as a note, in our practice, I think the average length is over 15 years that has been with our practice. We have some that are one that's been with us almost 30 years. Her entire career has been with our practice. So it's possible, and you can do it. Our shortest term hygienist, I think, was like 3 years. So you can do it. You can absolutely do it. You will absolutely lose a few. We've lost some, but you can still retain them on a high level.
Yeah, once you find the right people that understand the standard and you're working on your business, not in your business all the time, then it gets a lot easier for sure. Well, man, this has been another great episode of Management Unfiltered. Let's make sure we hit the YouTubes, subscribe, share the episode with all your friends, get in Zach's group, get on my Instagram at Kirk Teachout to make sure that we are uh, staying on top of things. Make sure that we're hitting the topics that you want, right? Zach, do you have any other comments, questions, quirks, anything?
No, just drop in my group and Kirk's Instagram what you guys want to hear on, comments of what you liked, what you didn't like, and then we can go from there. Love you guys, and we'll see you guys next time.
See you.
Come on, give me some.